Hello, my name is Dr. Brian Prax. I'm certified in functional neurology and I'm a registered Trigenics practitioner. And today I want to thank you for taking a look at our website and in particular about your chronic knee pain. So let's first talk about, in the next few minutes, what is knee pain and how we go about getting an 85% success rate. First of all, one of the things that I mentioned was chronic pain. Chronic pain is going to be pain that you've had at least 2 months or longer. 3 months or longer is what we're looking at. If you tore your knee up over the weekend, that's called an acute injury. You want to make sure that there's no pulled or strained ligaments, broken bones, or anything like that. The chronic, long-standing knee pain, anything from bone-on-bone, slight arthritis, all the way up to bone-on-bone arthritis to even if you've had a knee replacement. If you have pain, there's a good chance we can help you out, and here's how. Often, almost always in a knee injury, and that can come from an old football injury, stepping off a curb wrong 20, 30, 40, 50 years ago. It can even come from high heels, from chronic usage of high heels, dropped arches, plantar fasciitis in the foot. A whole bunch of different things can lead to knee problems. The first thing that any practitioner needs to do, and the first thing that we do, is examine. During an examination, we're trying to figure out what are the causes of this foot problem. Knee problem, and that was my next topic, is a lot of knee problems are actually coming from the foot. So if we have a dropped arch in the foot, look at that. If the arch is dropped, the knee bones, it's called the tibia and the fibula, those right off the bat are going to buckle up there at the knees. Your knee problem might be a foot problem, so that needs to be looked at. Also, the muscles that surround the knee, like your quadriceps, your hamstrings, well, those start way up in the lower back, at the gluteus muscles back here, your butt bone back there, we call the sits bone. All those muscles need to be evaluated. Back problems, pelvic misalignments, those could be related to your knee problem as well. Those have to be looked at. If there was an old knee problem or knee injury, then oftentimes in a splinting normal protective mechanism, the muscles around the knee pull really tight in order to protect it. And even though the injury is long gone, it might be a decade or more ago, if those muscles are still pulling, then what they do is they pull the knee joint together, and that's pulling the cartilage, putting cartilage on cartilage. Eventually, over time, that cartilage goes away, and then we call that bone-on-bone arthritis. It's not the arthritis that's the problem, it's the tightened muscles that have been in there for a long time. So for that, we use a technique called Trigenics. It's a neuromuscular reeducation, meaning we use certain techniques to teach the nerves to calm down, to control those muscles better, to relax, and allow and help that knee joint to go through its full range of motion. So Trigenics, you can look them up at trigenics.com for more information. That's an awesome technique that works for most patients. Another thing we'll use is cold laser therapy. Laser therapy has been shown to be safe and effective. It reduces inflammation, reduces pain, and speeds healing. Laser therapy is often used. If for those bone-on-bone, or maybe not quite bone-on-bone, but a loss of joint space, we'll often use knee decompression. It's a brand new technology that just kind of helps to gap that joint and get some pressure relieved out of there. That helps a lot. We might need to do mobilization. We might need to look at your feet. Maybe you need orthotics. All of these things need to be evaluated, and that's exactly the purpose of our examination. The exam is to figure out, can I really help this person or not? So during our exam or on the subsequent visit, I will let you know whether I think you'd be a good candidate for our program or not. If I don't think so, if maybe you are a knee surgical candidate, if that's what I think the case is, we're not here to waste your time. We're not here to waste your money. We're looking for great cases that we know are going to respond really, really well. So I encourage you to call our office. The number here is below, but again, it's 434-977-5433. You can always email us for more information, but give our office a call. Let's see if we can help you get this knee feeling and functioning so much better. I look forward to meeting you soon.